Welcome to Food, Environment and Health Channel. In the next few minutes, I will explain in the simplest way why neither Ozempic nor a strict diet is a good solution for weight loss. In fact, Ozempic might be even worse. Let's start with metabolic disorder, which is highly associated with obesity. It's insulin resistance. Insulin resistance is a condition in which the pancreas secretes several tens of times higher amounts of insulin in order to maintain blood sugar within desirable limits. To make the long story short, over the years of unhealthy habits, the pancreas is under pressure and first loses control over blood sugar levels, turning insulin resistance into type 2 diabetes. Eventually, if a person doesn't make significant improvements in her lifestyle, insulin secretion ceases due to pancreatic exhaustion, marking the transition from type 2 to type 1 diabetes. Insulin resistance is a condition detected by biochemical testing. Aside from a propensity for fat accumulation in the abdominal area and around internal organs, insulin resistance has no significant or noticeable symptoms. Individuals suffering from insulin resistance, due to a combination of genetics and an unhealthy lifestyle, including diet, lack of physical activity, stress, and irregular sleep, feel as if they gain weight out of thin air. Fat accumulation occurs because constantly high insulin levels in the blood conserve fat deposits. And then, many people consider addressing their weight issues by taking Ozempic. Ozempic, semaglutide, is a medication used to manage blood sugar levels in individuals with type 2 diabetes. As shown, it is effective in weight loss. It is administered through an injection and works by mimicking the function of a hormone called GLP-1 to stimulate insulin production, slow down digestion, and help to reduce appetite and increase satiety in the brain, potentially facilitating weight loss along with its blood sugar-lowering effects. In addition to Ozempic, there are also supplements advertised as a solution for obesity. Although weight loss supplement sellers claim that their products block the uptake of fats and carbohydrates in the intestines, affect appetite, or accelerate metabolism, these claims are often untrue. These preparations may contain plant materials, plant fibers, minerals, and some of them contain several ingredients which, when acting together, can lead to the emergence of new and unexpected effects. People often assume that plant-based or naturally derived products are harmless, but this is not the case. For instance, cocaine and heroin are of natural origin, and poisonous mushrooms can be lethal. The global supplement market had an annual turnover of $152 billion in 2021, which is already a strong incentive for supplement manufacturers who want you to believe that their products are necessary and effective. Let's get back to Ozempic. No official source recommends this medications for addressing obesity. Why? Let's compare Ozempic and rigorous diet. If you start using Ozempic, it is essential to change your dietary habits, as well as if you start with diet. In other words, there is no way to continue consuming large amounts of food or maintaining a high caloric intake while expecting to lose weight thanks to the use of antidiabetics. 2. Losing weight without physical activity results in an Ozempic body, which looks very bad. In other words, sudden weight loss without physical activity, whether due to a strict diet or Ozempic use, causes sagging skin and an older appearance. These effects on the body can be at least partially alleviated through exercising and building muscle mass. 3. Sudden weight loss without physical activity, whether due to a strict diet or Ozempic use, involves the loss of muscle mass, equally or more than fat deposits. This further causes 4. A yo-yo effect. Whether you were dieting or taking medication, rapid weight loss is always accompanied by a yo-yo effect due to hormonal mechanisms that persist in trying to return the body to its previous weight even a year after losing weight. 5. A strict diet or medication. It is completely irrelevant because, in both cases, there will be health consequences of insufficient intake of vitamins, minerals, and proteins. 6. Regardless of what you choose as a path, you will have to endure some difficulty. If you choose to diet, you will suffer from hunger, and if you choose to use Ozempic, you will suffer from nausea, which, along with other gastrointestinal side effects, can lead you to the hospital. In the end, the difference between dieting and Ozempic is that Ozempic is a new drug, which so far has indications that it increases the risk of thyroid cancer, pancreatitis, and kidney failure. In a few years, we might be surprised by the news about subsequently discovered harmful effects of prolonged use of Ozempic. Not the best, but the only solution for weight loss is to gradually introduce changes and gradually get accustomed to a new way of eating and adopting new lifestyle habits, step by step, without stress. More on this in the upcoming videos that follow. Thank you for your attention. If you enjoyed this video, please click the like and share buttons, and consider subscribing for notifications on more videos.